Here's a terrifying wake-up call about AI that every person using ChatGPT for health advice needs to hear immediately. While artificial intelligence has revolutionized how we handle everyday tasks, like finding restaurant recommendations or drafting emails, its venture into medical guidance has revealed some genuinely alarming blind spots. And this latest case study will make you think twice before asking your favorite chatbot about anything health-related. Picture this scenario. A health-conscious individual decides to cut back on his salt intake to improve his overall wellness. Sounds reasonable, right? Instead of consulting a doctor or nutritionist, he does what millions of people do every single day. He turns to ChatGPT for advice. What happened next landed him in a psychiatric ward with symptoms so severe that doctors had to place him under involuntary hold. But here's where it gets absolutely mind-boggling. When our well-intentioned patient asked ChatGPT for a sodium chloride alternative, the AI confidently recommended sodium bromide. Now, technically speaking, sodium bromide can indeed substitute for sodium chloride, but there's a crucial detail that the chatbot conveniently overlooked. This substitution works perfectly if you're trying to sanitize your hot tub or swimming pool. For seasoning your dinner, that's an entirely different story with potentially catastrophic consequences. The AI system failed to provide this essential context, essentially treating a pool cleaning chemical as if it were a harmless table salt replacement. Think about that for a moment. Would any medical professional, nutritionist, or even your neighbor with basic chemistry knowledge ever suggest using a pool chemical as a food additive? Absolutely not. And this is the part most people miss when they blindly trust AI recommendations. For 3 entire months, this unsuspecting individual incorporated sodium bromide into his daily diet, unknowingly poisoning himself with each meal. The accumulation was gradual, silent, and deadly. Then the psychiatric symptoms began manifesting in the most disturbing way possible. The patient started experiencing intense paranoid delusions, becoming convinced that his neighbor was actively trying to poison him. The irony is almost too painful to acknowledge. While he worried about external threats, he was systematically poisoning himself based on AI advice. Within the first 24 hours of his hospital admission, his condition deteriorated rapidly. He began experiencing both auditory and visual hallucinations, and his paranoia intensified to such an extreme degree that he attempted to flee the medical facility. Medical staff had no choice but to place him under an involuntary psychiatric hold due to what they classified as grave disability. Can you imagine the terror and confusion this man must have experienced, not understanding why his mind was betraying him? Once doctors administered antipsychotic medications and the patient stabilized enough to communicate coherently, he revealed his AI-inspired dietary modification. This revelation, combined with comprehensive blood work, led to a shocking diagnosis: bromism, a condition caused by toxic accumulation of bromide in the body. To put this in perspective, healthy individuals typically maintain bromide levels below approximately 10 milligrams per liter. This patient's bromide concentration measured an astronomical 1,700 milligrams per liter. That's 170 times the normal level. This level of toxicity could have easily been fatal under different circumstances. Here's something that might surprise you about bromism's history. This condition was remarkably common during the early 1900s, accounting for an estimated 8% of all psychiatric hospital admissions. However, cases plummeted dramatically during the 1970s and 1980s, when the medical community began phasing out bromide-containing medications. Essentially, we're witnessing the resurrection of a nearly extinct medical condition brought back to life by artificial intelligence recommendations. Fortunately, this particular story has a relatively positive ending. Medical professionals treated the patient over 3 weeks, and he recovered without any lasting major health complications. However, the implications of this case extend far beyond one individual's unfortunate experience. But here's the controversial question that's making medical professionals uncomfortable. Should we be more concerned about people's tendency to trust AI over human expertise? Or should we be demanding that AI companies take greater responsibility for the potentially life-threatening advice their systems dispense? The researchers who documented this case didn't mince words about their concerns. They explicitly stated that ChatGPT and similar AI systems frequently generate scientific inaccuracies, completely lack the ability to engage in critical analysis of their recommendations, and ultimately contribute to the dangerous spread of medical misinformation. They emphasized that no legitimate medical expert would ever suggest sodium bromide as a dietary substitute for sodium chloride when consulted by a patient. This raises some genuinely uncomfortable questions about our relationship with artificial intelligence. Are we becoming so dependent on AI convenience that we're willing to bypass human expertise even when our health and lives are at stake? And more controversially, should AI companies face legal consequences when their systems provide advice that results in hospitalization or worse? The research documenting this alarming case was published in the prestigious journal Annals of Internal Medicine, Clinical Cases, adding academic weight to concerns about AI's role in healthcare guidance. So here's my challenge to you. After reading this story, do you still feel comfortable asking AI systems for health-related advice? Or does this case demonstrate that some decisions are simply too important to delegate to artificial intelligence? Share your thoughts. I'm genuinely curious whether you think this incident represents an isolated AI failure or a warning sign about broader problems with trusting machines over medical professionals. What's your take on where we should draw the line between AI assistance and human expertise when it comes to our health?